Now we will do MCQs of chapter 24, acute inflammatory disease of the nose and paranasal sinuses. Here the first one MCQs. A 20-year-old male patient presented with the complaint of severe pain at the tip of the nose for last 1 day. On examination, tip of the nose was swollen and red with marked tenderness. Which microorganism is responsible for this condition? A option Haemophilus, B pneumococci, staphylococci, D streptococci, but the best and true option is staphylococci. The diagnosis of this condition is boil or furuncle. Boil is the staphylococcal infection of the hair follicle. In nose, the hair follicle is present only in the vestibule of the nasal cavity. Nasal vestibule is present in the most dangerous area of the face because its inflammation may spread and result in intracranial inflammation. The predisposing factor of nasal boil is diabetes mellitus, nasal scratching or nasal picking. The most presenting symptoms or first presenting symptoms of boil is pain in the nose. MCQs number 2. A 16-year-old male patient was diagnosed as a case of boil in the nose. What is the most common site of origin of this condition? Nasal vestibule. What are the two most important predisposing factors for nasal boil is diabetes mellitus and scratching of the nose. MCQs number 4. A 52-year-old male patient with uncontrolled diabetes mellitus came in ENT OPD and was diagnosed as a boil in the nose. Which of the following intracranial venous sinus thrombosis can occur as a complication in this patient? Cavernous sinus. MCQs number 5. A 22-year-old male patient came with complaint of sneezing, rhinorrhea, nasal obstruction, fever, headache, and body ache or malaise for the last 2 days. What is the most likely diagnosis in this condition? The most important option is diagnosis is viral rhinosinusitis, which is also called common cold or coryza. The predisposing factor for viral sinusitis is exposure to cold. The most important virus is responsible for viral rhinosinusitis is adenovirus, rhinovirus, and Coxsackie, and the other last one is ecovirus. MCQs number 6. A 23-year-old female patient came in OPD with nasal obstruction, sneezing, rhinorrhea, fever, and body ache for the last 2 days. Which of the following virus is the most common cause of such illness? Adenovirus. The diagnosis of this scenario is viral rhinosinusitis or common cold or coryza. 7. A 18-year-old female patient was diagnosed as a case of common cold. What is the characteristic nasal discharge in such condition? Watery and thin. Plain X-ray paranasal sinus was ordered in 25-year-old male patient who presented with nasal obstruction, nasal discharge, and post-nasal dripping. Which of the following view will be most helpful in this patient? Occipitomental view, which shows sphenoidal sinus, maxillary, and frontal sinuses. Plain X-ray of the paranasal sinuses or water view is helpful and show haziness or capacity in the affected sinus with or without fluid in it. By this view, we can assess condition of the maxillary and frontal sinuses. Condition of the sphenoid sinuses can be assessed if this view is taken with open mouth. This view is not an ideal view to assess ethmoidal sinuses. Plain X-ray was advised in 20-year-old male patient for assessing the paranasal sinuses. Which of the sinuses is most difficult to assess on this view? Best option is ethmoidal sinuses. But the condition is but the condition of the sphenoid sinuses, maxillary sinuses, and frontal sinuses can easily be assessed by plain X-ray or water view, except ethmoidal sinuses. MCQs 10. A 30-year-old female patient presented in ENT OPD with a complaint of thick mucopurulent nasal discharge, post-nasal dripping, nasal obstruction, and headache for last 8 to 10 days. Which are the common bacteria causing this illness? Option D, Streptococci and Pneumococci. Other causes include Haemophilus influenzae, and Klebsiella pneumonia. The diagnosis of this scenario is acute bacterial. The diagnosis of this condition is acute bacterial rhinosinusitis. 11. Proof puncture or enteral washout was planned in a 25-year-old male patient. Which of the following structure is drained in this operation? Best option is maxillary sinuses. For draining of the pus from the maxillary sinuses with the help of proof puncture or enteral washout. Trepanation was planned in a 22-year-old male patient to drain retained pus. Which of the following structure is drained in this operation? Best option is frontal sinuses. Trepanation is an operation in which a hole was made in the frontal sinuses to evacuate the pus from the frontal sinuses. If there is involvement of ethmoidal sinuses, then we will go for ethmoidectomy. But involvement of sphenoidal sinuses, then we will evacuate the pus from the sphenoidal sinuses with the help of puncture made in the sphenoidal sinuses.